If you're a senior in America or you're about to retire, 2026 brought some big changes to your benefits. Some of them will put more money in your pocket. Others will quietly take money away. And the problem is, most people have no idea these changes even happened. In this video, I'm going to walk you through 7 important benefit changes for 2026 in plain, simple English. No confusing government talk, no financial jargon. Just the facts you need to know to protect your money. I'll tell you exactly how much more your Social Security check is worth now, how much more you're paying for Medicare, a brand new tax deduction that could save you over $1,000, lower prescription drug prices, and a few other changes that could affect you and your family. My name is Joshua Boss, and this is Senior Benefits Decoded, where we make government benefits simple. If that sounds helpful, go ahead and hit that subscribe button and tap the bell so you don't miss our weekly updates. Because when it comes to your benefits, what you don't know can cost you. Let's get into it. Change number 1. Your Social Security check went up. Starting in January 2026, Social Security benefits increased by 2.8%. That's what's called the Cost of Living Adjustment, or COLA for short. The government does this every year to help your benefits keep up with inflation. So what does that actually mean in real dollars? Let me give you some real numbers. If you were getting $2,000 a month in 2025, your check went up by about $56 a month. That brings your new monthly payment to roughly $2,056. The average Social Security retirement benefit is now about $2,071 per month. That's the average. Your amount could be higher or lower depending on your work history and when you started collecting. Now, I know what you're thinking. $56 a month. That's it? And you're not alone in feeling that way. In a recent survey by AARP, 77% of older adults said a COLA around 3% would not be enough to keep up with rising prices. Grocery bills, utility costs, car insurance, home repairs. Everything keeps going up faster than that 2.8% raise. But here's the thing. This COLA increase applies to all Social Security benefits, not just retirement. It applies to survivor benefits if you lost a spouse. It applies to disability benefits. It applies to family benefits. And it applies to SSI payments too. You don't need to call anyone or fill out any forms. The increase is automatic. But I do recommend checking your January 2026 statement, either online at mysocialsecurity.gov or in the mail, to make sure your new amount looks right. Now here's where it gets tricky, because change number 2 is going to eat into that raise. Change number 2. Medicare Part B premiums went up, and they went up a lot. The standard monthly premium for Medicare Part B, that's the part that covers doctor visits, outpatient care, lab tests, and medical equipment, is now $202.90 per month in 2026. That's up from $185 in 2025. That's an increase of $17.90 per month, almost a 10% jump in just 1 year. Now here's why this matters so much to your wallet. Most people pay their Medicare Part B premium directly out of their Social Security check. It's automatically deducted before you ever see the money. So let's do the math together. That $56 COLA raise we just talked about, almost $18 of it is immediately taken by the Medicare Part B increase, just like that. So your real raise, the extra money you actually get to keep and spend, is closer to $38 a month. Not 56. This is why I always tell people you have to look at the full picture. The COLA sounds great when you see it on the news, but by the time Medicare takes its cut, the increase is a lot smaller than you'd expect. And it doesn't stop there. The Medicare Part A deductible, that's what you pay if you need to be admitted to the hospital, went up too. It's now $1,736 per hospital stay in 2026. That's up $60 from last year. And if your hospital stay goes beyond 60 days, you'll pay $434 per day for days 61 through 90. These are big numbers, and most seniors don't think about them until they're sitting in a hospital bed. The Part B deductible, the amount you pay before Medicare starts covering your outpatient care, is now $283 per year. Now, if you have higher income, your Medicare premiums could be even higher. The government charges what's called IRMA, the Income-Related Monthly Adjustment Amount. If your income is above certain thresholds, you pay a surcharge on top of the standard premium. If this applies to you, we'll cover IRMA in detail in a future video. Okay, now let me give you some good news, because change number 3 is something a lot of seniors have been waiting for. Change number 3. Prescription drug prices just dropped on some of the most popular medications in America. For the first time in the history of Medicare, the government negotiated directly with pharmaceutical companies to lower drug prices. This was made possible by the Inflation Reduction Act that passed back in 2022. And those new lower negotiated prices officially took effect in January 2026. The drugs that got cheaper include some names you probably recognize. Eliquis, which millions of Americans take for blood clot prevention. Jardiance and Januvia, two of the most popular diabetes medications. Entresto, used for heart failure, and several others. How much cheaper? Most of these drugs saw their prices cut by more than 50%. Some dropped even more than that. The Centers for Medicare and Medicaid Services estimates that these negotiated prices will save seniors $1.5 billion in total out-of-pocket costs just in 2026 alone. And there's more coming. Medicare is currently negotiating lower prices on 15 additional drugs right now, and those new prices will take effect in 2027. The next round includes some very popular medications, including the weight loss drugs Ozempic, Rybelsus, and Wegovy. So if you take any of the medications that were negotiated, check with your pharmacist or your Medicare Part D plan. You might already be paying less and not even realize it. And if you haven't checked your plan recently, now is a great time to do it. This leads perfectly into change number 4, which might be the biggest one of all. Change number 4. There's a brand new tax deduction created just for seniors, and it could save you real money. When President Trump signed the One Big Beautiful Bill into law in July of 2025, it included something called the Enhanced Deduction for seniors. This is a tax break specifically designed for people 65 and older. Here's how it works in simple terms. If you are 65 or older, you can now deduct an extra $6,000 from your taxable income. That's $6,000 on top of the standard deduction you already get. If you're married and both you and your spouse are 65 or older, that doubles to $12,000. Let me put that into perspective. If you're in the 12% tax bracket, which is where most retirees fall, a $6,000 deduction could save you $720 in taxes. If you're a married couple claiming $12,000, that's up to $1,440 back in your pocket. Now, who qualifies for the full amount? Here are the income limits. If you're a single filer earning up to $75,000 per year, you get the full $6,000 deduction. If you're married filing jointly and your combined income is up to $150,000, you both get the full deduction. If you earn more than those amounts, the deduction gradually shrinks. This is called a phase-out. For single filers, the deduction disappears completely at $175,000. For married couples, it disappears at $250,000. Now, here's an important detail that a lot of people miss. If you're a senior who doesn't earn enough to owe federal income taxes on your Social Security, this new deduction won't help you. It only benefits people who actually have taxable income. For single filers, you generally don't owe federal taxes on Social Security unless your combined income is above $25,000. For married couples filing jointly, That threshold is $32,000. So if your income is below those levels, this deduction unfortunately doesn't apply to you. One more thing. This is a temporary deduction. It runs from the 2025 tax year through the 2028 tax year. So you can claim it starting on your 2025 tax return, which most people will file in the spring of 2026. After 2028, Congress would need to pass new legislation to extend it. My advice? Talk to your tax preparer about this as soon as possible. If you do your own taxes, look for this deduction in the updated forms. Don't leave free money on the table. All right, change number 5. This one is about when you can retire with full benefits. Change number 5. The full retirement age has officially reached 67. If you were born in 1960 or later, your full retirement age for Social Security is now 67. This is the age at which you can collect 100% of your earned Social Security benefit with no reduction whatsoever. Now, this has been gradually increasing for years. It used to be 65, then it moved to 66, then 66 in a few months. And now, for anyone born in 1960 or later, it has settled at 67. You can still start collecting Social Security as early as age 62. Nobody is stopping you. But here's what most people don't fully understand. If you claim at 62 instead of waiting until 67, your monthly benefit gets permanently reduced by 30%. Let me say that one more time because it's that important. 30% less. Every month. For the rest of your life. Let's use real numbers. Say your full benefit at age 67 would be $2,000 per month. If you claim at 62, that drops to about $1,400 per month. That's $600 less every single month, and it never goes back up. Over a 20-year retirement, that 30% reduction could cost you over $140,000. Now, on the flip side, if you delay past your full retirement age of 67, your benefit grows by 8% per year until age 70. That's a guaranteed 8% increase every year you wait. No investment in the world gives you a guaranteed 8% return like that. At age 70, the maximum possible Social Security benefit in 2026 is $5,181 per month. That's for someone who earned the taxable maximum throughout their career and waited until 70 to claim. So the question of when to claim, 62, 67, or 70, is one of the most important financial decisions you will ever make. And it depends on your health, your savings, whether you're married, and your overall financial situation. We're going to do a complete deep dive video on exactly when you should claim Social Security, with real examples and calculations very soon. So if you haven't subscribed yet, now would be a great time to do that. Change number 6. If you're working and collecting Social Security at the same time, the earnings limit's changed. Change number 6. The Social Security earnings test limits went up for 2026. Here's the deal. If you're collecting Social Security retirement benefits, but you haven't reached your full retirement age yet, and you're still working, there's a limit on how much you can earn before the government starts reducing your benefits. In 2026, if you're under full retirement age for the entire year, you can earn up to $24,480 from work without losing any Social Security benefits. That's up from $23,400 in 2025. But if you earn more than that, Social Security will withhold $1 in benefits for every $2 you earn above the limit. Let me give you an example. Say you earn $40,000 from a job in 2026. That's $15,520 over the limit. Social Security would withhold $7,760 from your benefits that year. That's half of the amount you went over. Now, in the year you reach your full retirement age, the rules get more generous. The limit jumps to $65,160, and the penalty is lighter. Only $1 withheld for every $3 over the limit, and only for the months before you actually hit your full retirement age. And here's the good news that most people don't know about. Once you reach full retirement age, this earnings test completely disappears. Gone. You can earn as much as you want from working, 100,000, 200,000, it doesn't matter, with zero reduction to your Social Security benefits. And the money that was withheld before? Social Security doesn't just keep it. They recalculate your monthly benefit upward once you hit full retirement age. So over time, you get that withheld money back through higher monthly payments. So if you're working and collecting, don't panic about the earnings test. But do know your limits so you're not caught off guard. Now let's talk about the last change, and it's one that could save you thousands of dollars. Change number 7. There's now a hard cap on how much you pay out of pocket for prescription drugs under Medicare Part D. In 2026, if you have Medicare Part D prescription drug coverage, your total out-of-pocket costs for covered medications are capped at $2,100 for the entire year. Let me explain why this is such a big deal. Before this cap was introduced, there was essentially no limit on what seniors could pay out of pocket for their drugs. In 2024, some seniors were paying $8,000, $10,000, even more out of their own pockets for medications they needed to stay alive. Cancer drugs, specialty medications, insulin. The costs were crushing. Now there's a ceiling. Once you spend $2,100 out of pocket on covered Part D drugs in 2026, you're done paying. For the rest of the year, your covered prescriptions cost you $0. The insurance plan and the drug manufacturers pick up the tab after that. This went up slightly from 2025, when the cap was $2,000. But even at $2,100, this is life-changing for people on expensive medications. Now, there are a few important details you need to understand. First, this cap only applies to drugs that are covered under your specific Part D plan's formulary. A formulary is a list of drugs your plan agrees to cover. If your medication isn't on that list, the cap doesn't help you for that particular drug. Second, premiums you pay for your Part D plan do not count toward the cap. Only actual out-of-pocket costs at the pharmacy count. Third, the average Part D premium in 2026 is about $34.50 per month. But this varies widely depending on which plan you choose. My advice? Pull out your current medication list and check it against your plan's formulary. Make sure everything is covered. If something isn't, consider switching plans during the next open enrollment period, which runs every year from October 15th through December 7th. All right, let's put it all together. Here's what these 7 changes mean for your wallet in 2026. Number 1. Your Social Security check went up by 2.8%, about $56 a month on average. That's real money, even if it doesn't feel like enough. Number 2. Medicare Part B premiums went up to $202.90 a month. That eats about $18 of your raise. Your hospital deductible went up too. Number 3. Prescription drug prices dropped on 10 popular medications, with more coming next year. Check your pharmacy for savings. Number 4. There's a brand new $6,000 tax deduction for seniors 65 and older. Up to $12,000 for married couples. Talk to your tax preparer now. Number 5. Full retirement age is now 67 for anyone born in 1960 or later. Claiming early at 62 costs you 30% for life. Number 6. If you work while collecting Social Security, the earnings limit is now $24,480 before benefits are reduced. After full retirement age, there's no limit at all. Number 7. Your out-of-pocket prescription drug costs under Medicare Part D are now capped at $2,100 per year. Once you hit that amount, you pay nothing more. Some of these changes help you, some of them hurt. But the most important thing is that you know about them. Because when it comes to your benefits, knowledge is money. And nobody is going to fight for your benefits except you. If this video helped you understand what's happening with your benefits, I'd really appreciate it if you'd hit that subscribe button. We post new videos every week breaking down Social Security, Medicare, and every benefit available to seniors, all in plain English. And do me a favor, if you know someone, a spouse, a parent, a neighbor, a friend from church, who needs to hear this information, please share this video with them. A lot of seniors miss out on money they're owed simply because no one told them. Coming up next on this channel, I'm going to break down exactly when you should claim Social Security. At 62, 67, or 70. I'll show you the real math with examples, so you can see exactly how much each choice costs you or saves you over your lifetime. The answer is going to surprise a lot of people. Until then, this is Senior Benefits Decoded. I'm Joshua Boss. Take care of yourself and take care of your benefits. I'll see you in the next one.